All right, this is Joe Johnson of Cancer Dudes Live More, and today I have a special guest with me, Bill Henderson, who is the author of the book Cancer Free, Your Guide to Gentle Non-Toxic Healing. It's a great book, and Bill's been helping people with cancer for almost 15 years now, so I'm really excited to have him on with me today and be sharing a lot of his knowledge that he's accumulated over the years. So, Bill, thank you so much for coming on with me today.
I'm delighted to be here, Joe, and I admire you for what you're doing, but basically in any way I can help with that, I'll be glad to do it.
Well, thank you. And, for people who aren't familiar with you or your book, how did you first get into this whole field of cancer?
Well, I went through an experience with my late wife back in the early 90s. It was frustrating. She got ovarian cancer, and I was trying to help her, and looking around, in the libraries and so on, there wasn't any internet then to amount to anything.
Mm-hmm.
And I was frustrated. I couldn't find anything to help her, and she went through a lot of chemo and surgery and what have you, the sort of conventional treatment, and got worse. We got an enormous amount of pain, and after 4 years of that, she was ready to go, believe me, and she finally did in 1994. She passed away, and basically what I've learned since then is that the treatment she got, the chemotherapy particularly, and the surgery and all of it, and the pain medication, all of that was what killed her, basically. So I've taken that experience, Joe, and tried to help as many other people as I can avoid her fate, I guess. That's what I've been doing. About 98 it was, I guess, I discovered about how much information there was even then. This is 15 years ago. Mm-hmm. On the internet about alternative ways to deal with cancer. That were not toxic, that were not killing people like the chemotherapy does. And I began studying that and had a experience with a family friend that I was able to help get over her cancer after she had a lot of chemo and so on. And I became, really enthusiastic about trying to help as many people as I could. So I started writing books. The first one I wrote was a pretty primitive ebook on the internet, but I started contacting people all over the world, because, and gradually, it's grown to where I now have this book you mentioned, which is in its 4th edition, and I have an MD, a wonderful doctor that's a good friend of mine, who is my co-author now, and we both believe the same things about how to heal cancer, and we try to spell it out in the book as much as we can.
Mm-hmm. And so you mentioned then when we were talking before getting on here is that you've kind of figured out why people get cancer. What have you found in your experience? Why does cancer seem to come about in people?
Well, it's interesting. I've been doing this telephone coaching and Skype and so on all over the world for people with cancer for at least about 13 years when I started doing this back in 2000, I guess. And these people, I don't know, it's 4,500 people approximately that I've talked to. And they've taught me, I think, Joe, why people get this so-called disease. I don't like to call it a disease. I call it a reaction of our body to what's happened to it, basically. And what they've taught me is that there are only 3 major reasons that I found. It kind of jumps out at you after you talk to that many people. 3 major reasons why people get cancer. Mm-hmm. One of the obvious ones, of course, is what we eat and drink. Mm-hmm. That applies to almost everybody. But the other 2, no doctor ever explores either one of these. The conventional cancer treatment doctors. One of them, of course, is stress. Emotional and all kinds of other stress issues that we go through, that challenge our body, our immune system, that make our body acid and so on. And the other is dental toxins. Almost everyone has dental trauma, as it's called, where they've had dental work done, root canal jaw-filled teeth, cavitation sites where they've had teeth removed that are infected in their jawbone or whatever.
Mm-hmm.
Mercury amalgam, obviously. All of these things bring on cancer, literally. The intimate relationship between our jaw and the rest of our body and every organ in our body is really unknown totally to doctors and almost all dentists. It's amazing, but the dentists are not trained in physiology and how important it is, to identify problems with the teeth that are related to organs and that cause things like cancer and heart disease and fibromyalgia and arthritis and all kinds of other physical problems that are related to our teeth. It's amazing. And the reason I know this, Joe, and I'm positive of it, is because I talk to these folks and they give me a little history of what they've been through. Most of them are coming to me kind of as a last resort. Been through, they trust the doctors like most of us do when we get sick, and they start doing the chemo and surgery and radiation, whatever. And that doesn't work. The cancer comes back. They finally wake up and they start doing more sensible things like what I recommend in the book, the supplements and dietary changes and on and on. And those don't work either. They get better. They may feel more energy, but they don't get over the cancer. Finally, after I nag them enough, they go to the good dentist that I refer people to, get their jaw cleaned up, and they get well. I mean, this is hundreds of people now, so it is proven to me that this is the primary reason. And of course, there are lots of other people I work with, experienced cancer clinics and dentists and so on who have reached the same conclusion that I have. That this is one of the primary reasons we get sick. And it's not explored by doctors at all. They don't, the dentists are in one universe and they're in another one. Never the twain shall meet. So it's important, and I try to help people as much as I can to get to a good, competent dentist, and these are very, very rare, unfortunately.
And is there a certain place where people can find more natural dentists and things like that, or where do you recommend people to go?
Well, there are some organizations. There's one called IAONT. I think it has a website, IAONT.org, and these are dentists who are mercury-free. Basically, they have realized the terrible nature of mercury in our mouth. Unfortunately, most of those dentists that belong to that organization do not qualify as far as I'm concerned. My standards are pretty high for a dentist because I've had so much experience with people that have tried certain dentists and have not really gotten a complete cleanup of their jaw. One of the better organizations is called IABDM. It stands for International Academy of Biological Dentistry and Medicine, IABDM.org. The members of that, I'm going to be talking to their convention next month in Houston. Most of the dentists that belong to that organization are pretty competent. And, I know the people that run that organization better. So I would, but in my coaching service that I do, which is at my website, if it's okay, I can mention that.
Yeah, of course, yeah.
It's beating, BEATING, and then a hyphen, cancer, hyphen, gently, GENTLY.com. At that website is a coaching page, and you can sign up, and I'll be glad to coach anyone. And in that process, we go through, which dentists that I know of are closest to them, and, what I know about them, and then I try to discuss with them the option, for example, of going to Tijuana, where there are two dentists there that I really trust and admire, who have helped quite a few people that I've worked with, and who charge considerably considerably less than the ones here in the United States.
Mm-hmm.
So if money is a big issue, I try to encourage people to go there.
Mm-hmm.
But these dentists are so rare that I have a list of them that I maintain, and I'll add a dentist to it or take one off of it occasionally because of the feedback I get from people
Mm-hmm.
about their own experience. So it's kind of a dynamic list, but that's one of the things I provide these coaching patients I work with is, information about dentists and so on.
Right.
Very important, by the way. It's probably the major thing I've found involved in virtually all chronic degenerative conditions, if you want a category. Anything, some of the dentists I've worked with, these wonderful dentists, have healed themselves of things like ALS, Lou Gehrig's disease, MS, things that were diagnosed with these terms that they've been able to heal themselves of once they discovered how intimate the relationship is between our teeth and what happens in our body.
Mm-hmm.
And they have become, wonderful, what I call biological dentists.
Mm-hmm.
Fortunately, that term, there's nobody controlling that term, so anyone can call themselves a biological dentist. But these guys have trained themselves, after dental school to diagnose and treat conditions by cleaning up the jaw that relate to the teeth and the jawbone, literally.
Mm-hmm. Yeah, and I'll post a link to your website as well as to the IABDM and some of the other organizations. But it is so unfortunate, that there's so few dentists out there doing this work. I only know of one in the Boston area where I am, Groton Wellness. I'll post a link to them as well. But it's unfortunate, and I've had great work done by them. I've had all my mercury fillings taken out. But, those mercury amalgams are just so toxic for the body, and getting those infections down in root canals and things like that, those are things that the body's never been going to be able to overcome by itself unless you clean them out and get it out of there. So I'm glad that you brought that up. That's something that not many people are talking about at all in the world of cancer.
We're fortunate to have somebody that close who is as competent. I've referred quite a few people to Dr. Evans and Groton Wellness.
Oh, nice.
In Groton, Mass. But those people that are so rare, most of the folks I work with, Joe, have to travel 1,000 miles or more to find a competent dentist.
Mm-hmm.
And, this is unfortunate. The numbers I give people are something like this: 167,000 dentists in the American Dental Association. Of those, there are less than 50 that I would trust to clean up my jaw if I was sick. Very, very difficult to find a good one, and that's why I try to maintain this list and urge people to go to one of these really good dentists. Groton Wellness, I know Dr. Evans is kind of the head there, but he has quite a few other dentists working with him that are also, quite good dentists as far as I know.
Right. Yeah, that's great. Well, I'll definitely post a link as well to your coaching page where people can get in touch with you to find out more about the dentist, because that's definitely a great resource. And so can you talk a little bit more about the stress that you mentioned and the emotional side of it?
Yeah, sure. Interesting in that virtually I'd say in my experience, it's 60-70% of people that I work with, once we talk a little bit about the history that led up to the diagnosis of their cancer, they can readily identify something traumatic that they went through in that period. Usually it's 3 years or less before the cancer is diagnosed. It can go back a little farther than that, but typically it's 3-4 years or less. And it's things like a difficult divorce or bankruptcy or moving around the country or loss of a job or, loss of a loved one or child, something like that. Taking care of an elderly relative with Alzheimer's. People go through a lot of stress. And it's interesting that physically it's been determined that stress always produces acidity and a weak immune system. The acidity is caused by cortisol, which you've probably heard of. It's a hormone produced internally in our bodies when the brain signals our endocrine system that, hey, we're under stress here, we have to change the blood flow to the extremities and so on. It's the old fight or flight syndrome. You've heard of that, where our ancestors were chasing the animals or running away from them or whatever. And all living things go through this same physical change when they get under stress. And what people don't realize is that this is kind of cumulative in the body. And when you have enough stress, producing enough of this acidity, which is very conducive to cancer, of course, and, of course, getting your immune system challenged, you're very vulnerable to getting cancer because that's what it loves. It thrives in an acid environment, and, of course, you can't get cancer until your immune system is somehow overwhelmed. A weak immune system goes with cancer, basically. So no surprise to me that the majority of people seem to have this stress period in their life that precedes the cancer. And usually, in my experience, it is combined with the dental toxins that they've had for some time. I mean, I work with people in their 60s, 70s, 80s, and so on who have been through a lot of dental work early in their life, and their immune system has handled the toxic load coming out of their jaw for some decades in many cases, but it has been challenging their immune system. The dental toxins cause acidity as well and challenge the immune system. Well, then they go through some kind of stressful period in their life, and surprise, the body gets overwhelmed, the immune system, by the combination of these two things, and they get a cancer tumor or some other form of cancer. This is very, very common scenario. I run into this all the time, Joe.
And then how do you recommend people deal with that then?
Well, it's an interesting thing. I've studied a lot of things. Emotional freedom technique, you've probably heard of that. Dianetics, psychosis, hypnosis and psychiatry, all these things that try to deal with these issues. The one I've found that is the most practical is Dr. Brad Nelson's book called The Emotion Code. And I urge people to get that book and work through it, because what he has worked out is a do-it-yourself exercise using kinesiology, which is a fancy name for muscle testing,
right,
to determine, which emotional issues are in your subconscious and still affecting your health, usually from your past, from some past incident that you've experienced. But your subconscious, as he discovered in his practice as a chiropractor, it has its own priority system, basically. And it is still concerned with and affecting your body with issues from your past. And one of the ways to determine that is the procedure he has in this book. It's called The Emotion Code, and it's a very inexpensive book on Amazon. Dr. Brad Nelson is the author of it, a good friend of mine. He found in his practice, though, that every patient that he dealt with for 18 years had an emotional component of their problem, whatever it was. Lots of cancer patients. And he wrote this procedure out that he's put in this book. And he quit his practice in 2005 to write the book and get the word out to the world. And he's traveled since 2007 when this book was published. He's traveled all over Europe and Canada and the United States and Australia and so on, giving seminars on this subject and trying to help people, get a handle on the emotional issues in their subconscious, literally. It's things we're not aware of from our past that are definitely affecting our health. And this book has a very simple procedure for dealing with them, getting rid of them, basically. Erasing a portion of your of this big tape inside us. It's our, our subconscious with its memories of what we've been through.
Mm-hmm.
It's a pretty simple procedure, and I urge everyone to get the book and try at least try that as a method of dealing with this. But it's very, very commonly involved because I've had lots of people tell me that they found things they were not aware of from their past that were definitely bugging them still.
Mm-hmm. Yeah, it's definitely important. That's something I do in working with people as well, is muscle testing to look at different emotional issues that are going on in the subconscious. And so I definitely encourage everybody to pick up the book because it's something so important, something that the body holds on to until you are able to release it through one of these techniques. That's something so important. Again, like the dental work, something that's not really talked about by anyone, even in a lot of the alternative cancer areas, which is unfortunate.
I know. It's the knowledge that you and I have gained is rather rare among the clinical treatment. Even the most natural cancer treatment clinics, and there are quite a few of them, as you know, in Germany and Mexico and so on, and a few in the United States. Most of those are not as familiar with these two issues as I am, and maybe you are. There is one clinic, an interesting clinic in Switzerland called Paracelsus, which has been dealing with cancer since, 1957, I think. And they have a dental section as part of their intake for cancer patients. And before you get any cancer treatment there, you get your jaw cleaned up. It's interesting. They did a study. Well, Dr. Thomas Rao is the medical director there. And he got curious along about 2004 about the women coming to that clinic with breast cancers and how it related to dental issues. And he went and dug out 150 of the last women who had checked into that clinic at the time with breast cancer. And he found that 147 of those 150 women had root canal filled teeth directly over the original breast tumor. In other words, it was obvious that the two were related. The other three women had other kinds of dental issues. So this is, and they've had this dental intake procedure there for about 20 years that I know of. They're well aware of this issue, but very, very few clinics are. I've worked with a few, like Dr. Carlos Garcia, my co-author, that are well aware of it and refer their patients to a local dentist and so on, but it's unusual.
And then, kind of the first thing you mentioned in the beginning, the nutrition. What do you find is most important for people to do in that area?
Yeah, very important because really you can't get over it even if you deal with these other two issues without changing the eating habits dramatically and, of course, taking some supplements. As you know, there are literally hundreds of things that have been documented over the years that have helped people heal cancer. Substances that you take and devices that you use and what have you. We've tried to boil that down to something simple in the way of a regimen or protocol, whatever you want to call it. Basically, that is dealing with the important and essential issues that have to do with cancer. Of course, one of those is eliminating from your diet the things that are the most productive and helpful for cancer to grow. And these are things like sugar, obviously, processed food, which is very, very harmful in most cases. Things like animal protein, excess animal protein is not healthy for most of us. And dairy products and what we call gluten, which is cereal, pasta, and so on. We urge people to eliminate those things from their diet, at least for the first few months of their healing process, and essentially concentrate, of course, on veggies. Raw veggies are ideal in most cases. Vegetable juicing, of course, is fine. We kind of vegetables, it gets rid of the fiber in the vegetables. So we encourage them to use either a Vitamix or Blend-Tech or a mixer like that that retains the fiber and the nutrients of the veggies in if you can. Otherwise, the juicing is fine as long as you're eating enough fiber in the raw veggies or some other form like beans or lentils or whatever.
Right.
You try to minimize the cooked food. Keep it down to about 20% of what people eat. And of course, we emphasize the cottage cheese flaxseed oil mixture as, for most people, a wonderful way to reform their cells. The cell membranes are reformed by this mixture of our normal cells that make them much more efficient. And, of course, at the same time, that mixture attracts oxygen to cancer cells and kills them off or reverts them back to their normal state when they die off and so on. Cottage cheese flaxseed oil is a wonderful mixture for most people. There are few people I've worked with that have had chemotherapy to the point where their body is not absorbing the fats and so on involved that are healthy. And, the cottage cheese flaxseed oil doesn't work well for them. There's a new product out fairly recently called Procella, which is kind of interesting in that it's a capsule form of this mixture of cottage cheese flaxseed oil in a capsule form that is quite convenient for people traveling. But it also seems to work better for some folks who've had a lot of chemotherapy and so on. So those kind of dietary issues we deal with a lot. The other thing, of course, is taking supplements that rebuild the immune system, ideally. We like the form of beta-glucan we recommend. A particular brand of it is excellent. Try to get people to take it's called Barley Power. It's a supplement that is loaded with alkalinity and with enzymes that our body needs. The barley is very efficient at restoring a lot of enzymes that we're deficient in, which is hard for doctors to measure. They really don't have any way to measure which enzymes we're lacking in. So taking barley is one of the wonderful ways to load your body with enzymes and alkalinity. So we urge them to do that, as well as vitamin D3, an essential part of healing cancer, as it turns out. And, of course, a vitamin mineral mix and another mixture that we found is helpful for stopping the spread of cancer. The metastasis of cancer, of course, is what kills most people, basically, because it spreads to vital organs. So stopping the metastasis is important, and there's a mixture that we recommend that does a pretty good job of that. It's very inexpensive. So those are the kind of things we try to get people to start on, even before they get an appointment with a dentist or somebody that can check out their jaws and do them that way. So, they obviously nutrition is vitally important. You'd be surprised how many people I hear tell me that, they asked their doctor about this, and the doctor said, eat whatever you want. Nothing to do with cancer. Just go ahead and eat your balanced diet, and if you want to eat ice cream or candy or whatever, just press on. Those are the oncologist offices I was in when my wife was going through this back in the early 90s, had plenty of candy out in the waiting room for their patients to eat while they were waiting. This is fairly typical.
Right. It's unfortunate that, it's nutrition is not more mainstream, but, thankfully we have people like you that are getting this information out there and writing books and things like that. Hopefully we can continue to expand the people that know about this. But, so in...
doing it long after I'm gone. So God bless you.
Right. But you say you've worked with almost 5,000 people now. What kind of results have you seen from them after they've been following some of these different practices and things?
Yeah, really good question, because I do not keep statistics on people simply because I don't follow up with them routinely every couple of weeks to see what kind of compliance they're doing and so on. I mean, these are people that I consult with and try to give as much information as I can, but I have no real control over what they do themselves at all, like they do in a clinic. But I heard back from enough people, and on my website are literally hundreds of testimonials from people who have done this and healed themselves. So the feedback I'm getting is pretty indicative that if people follow this regimen that I've talked about and deal with the causes, which they have to focus on, by the way, deal with the causes of their cancer to reverse them, they get over it. And whether it's, 70% or 60% or whatever of the people I work with, I have no statistics of that type. I don't try to keep, individual records of people with, every week or so. How are they complying? Are they doing it? What are they doing that we don't recommend, et cetera, et cetera? There's no way I can do that. But the one thing I have definitely determined is that those who deal with the cause and concentrate on that, Joe, the number who get well is much, much higher than those who do not.
Yeah, that's so important is getting back to the cause, and most people don't know that you can actually find out the cause, and that we know many of the causes as we've talked about today already.
That's right.
That
I've asked every person I've talked to, Joe, the same question: has your cancer doctor ever discussed the cause of this with you? And the answer is always no. Now think about that. How sensible is that to try and treat somebody for something that's obviously involving their whole system, not just one organ where the tumor is, but that it's a systemic problem, out of balance. The body's out of balance for some reason, and the cancer has overwhelmed the immune system. And the doctors don't even try to explore this. They just treat the symptoms, okay? They treat the cancer tumor as if it were the enemy that has invaded your body. That's their approach, basically. And it doesn't work. It's what they're trained to do in medical school, but it does not work. It is very lucrative, makes a lot of money for a lot of people, but it doesn't heal anyone. Obviously, we all know people that have been through cancer treatment and survived. A very, very small percentage of people. It turns out to be about 2%. According to a large study done in Australia they finished it up in 2004. It was cancer doctors now, not alternative doctors. They were studying the improvement in 5-year survival for people who did chemotherapy for their cancer. And they looked at 235,000 cancer cases, 170,000 in the United States and about, 65,000 in Australia. And they found that of all these, 35, 40 different types of cancer, that the average improvement in 5-year survival for those who did chemo was 2%. 2.1% in the United States, 2.3% in Australia. And this was several cancers, testicular cancer is one of them, maybe certain types of lymphoma and so on, very rare cancers, do respond more to chemotherapy than most of the common cancers. For example, they found that breast cancer, the response or improvement rate was 0.7%. Well, the testicular cancer was up around 30 to 35%. Our friend, the biker, the poster boy for testicular cancer and
Right.
conventional treatment, Lance Armstrong, I mean, hey, well, he had a form of cancer that responds much more so than most to that kind of treatment.
Mm-hmm.
But what people don't realize is that doctors continue this. This study was published in the Journal of Oncology. Get this now. It's supposed to be read by oncologists. Was published in that journal in 2004. And, this is 9 years ago, and they're still doing the same treatments they were then.
Mm-hmm.
It didn't affect anything.
Right.
So, it's not that the knowledge is not there. It's there.
Right.
It's just that the treatment routine for most cancer patients generates about $1.2 million per person for this, cancer industry.
Mm-hmm.
They're not about to stop that status quo, unless they're forced to.
Yeah. There's no money to be made in eating a good diet and getting the dental work done and things like that, the emotional piece.
You got it.
But, yeah, I mean, besides reading your book and looking at your website and things like that, do you have kind of any advice for somebody who might be watching this interview who's, who maybe just been diagnosed with cancer or is kind of dealing with it?
Well, yeah, if you or your loved one gets a cancer diagnosis, in order to overcome the normal emotion, which is very common because of all of the information that we have about cancer and how emotional it is, I hate that word because it is very conducive to fear when people hear of a cancer diagnosis because it's about the celebrities who are battling cancer and they go downhill, they look terrible and they die and so on. And of course, most people have seen relatives and friends of theirs who've been through this treatment and look terrible, literally. I mean, I hate to think about the folks in the chemotherapy wards that I visited with my late wife going through chemo. I mean, they look like death warmed over. So it's enough to frighten people.
Mm-hmm.
What I recommend people do is substitute, if they can, ideally before they ever hear a cancer diagnosis for themselves or a loved one, substitute for that word cancer a phrase that my friend Mike Adams thought up at the Natural News, which is much more descriptive of what cancer is. It's a term abbreviated SISD, and I urge people to write that down and memorize it. It stands for sluggish immune system disease.
Mm-hmm.
That's what cancer is. There is no way to get cancer with a strong immune system like you and I have, okay? Literally, I have no fear at all of ever experiencing cancer. Of course, if I do, I think I know how to deal with it. But the point is, the fear is usually caused by ignorance of why this happened to you, and what can I possibly do about it. So, acquiring that knowledge ahead of time is very helpful. Most people won't; they wait until they get the diagnosis. But if we can get the word to people that this is nothing to fear, that most cancers, particularly, the one thing the medical system has done is to help determine cancer earlier in the process. But, of course, there are a lot more cancers now than there were 100 years ago. Why? Because of some of the reasons that we've been talking about here. So, the fact is that 41% of us are going to experience cancer ourselves at some point in our life. 1 out of 2 men, 1 out of 3 women is what the statistics are. Well, it's growing. It's getting worse. So somebody close to us is going to experience this. And the more you can learn to alleviate the fear that goes with this diagnosis, the better. And the sooner you learn that, of course, the more likely it is to come up when you hear this word cancer from the doctor. But remember, doctors know nothing about healing cancer. they're completely ignorant about what it is and how to deal with it.
Mm-hmm.
It's a hard one for people to accept, but it's a fact. They're trained in medical school in a way that is so limited in its scope, that they have blinders put on, basically, the first day of medical school, and they can't look around as I've done, and Dr. Garcia and a few others that have broken out of this mold that are formerly trained doctors, or a few of them have gone and recent as I have. But the doctors have not. And, when you begin to try and discuss with them, what can I do that is not as invasive as the surgery or the chemo or whatever, they're going to tell you that there is no such thing, and that everything that I'm suggesting and that Johnson and everybody else is suggesting is just pure quackery.
Mm-hmm.
Well, if you're prepared to hear that and you have some information, you're going to dismiss it. I am convinced, Joe, that every cancer death is attributable to lack of information.
Mm-hmm.
People didn't learn soon enough what this is and how to deal with it, and essentially they trusted the doctors and allowed them to in ways that were very harmful.
Mm-hmm. Right.
So information is vitally important.
Mm-hmm. Right. Yeah, well, that's definitely a great point. Is people should be getting information as much as possible. So I'm definitely going to post a link to your website and book, and that's what I'm trying to do as well. Is get this information out there, how people can, uncover these causes of their cancer, and then really build up that sluggish immune system that they have, and do everything they can, because that's so important. So I'm so glad that you brought that up.
Well, God bless you, Joe. You've got a long time to enjoy the wonderful feeling of helping people to heal themselves. It's the most fulfilling thing I've done in my life, and believe me, I've done quite a bit of stuff, and this is the best by far, believe me. And I want to bless you to continue doing it, as long as you can. So it's wonderful.
Well, thank you, and thank you so much for coming on with me today. I know this interview is going to help a lot of people, so we'll get it right up there and start spreading the word as much as we can.
Well, keep in touch, Joe. Good to hear from you.
All right.